Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and this is where you can learn how you can heal your musculoskeletal problems without surgeries. So give us a call right here, right now in the studio, 866-870-5752, 866-870-5752. You get a free book. Stem Cell and Platelet Therapy, Regenerate, Don't Operate is the title. It has 264 scientific studies. And what do you think, Dr. Darrow? Would you like to talk to OC?
I would. OC, how are you today? Dr. Marc Darrow here.
How you doing? Let me call up the radio. Just a minute.
All right.
I can barely hear you, but if I put you on speaker, let me see. Okay. Here we go. Can you hear me pretty good right now?
Beautiful. So you have a neighbor whose son or daughter has spina bifida? Is that correct?
Yes. Yeah, she's very sweet, man. She's a beautiful Hispanic girl. She's about from 8 to 10, and she hops around. She has a beautiful personality. She don't let it stop her.
Okay.
You know, she goes to school. She has a little car, the truck that comes by and pick her up, take her to some type of thing that for recreation. And
okay.
She has, and I just want to know if there's any probability or possibility she can be aided.
Let me explain what that's all about, because it's something that, it's not really something that I deal with. It's more of a neurological issue, but I know about it. We obviously study that. So it's a birth defect that occurs.
Yeah, I looked it up. It's a birth defect. Yeah, you're right about that.
All right. Can I explain? It's a birth defect which happens in the developing baby's spinal cord, and it fails to develop properly. There's often a defect in the vertebrae, and then the spinal cord and nerves can actually pop out through the back, and sometimes there's spinal fluid that can leak out. There are so many different levels of intensity of what it is. Some people that have it have zero problems at all. Some people that have it are paralyzed from it, from the waist down. So in this case, the little girl is, you said, hopping around, which means she doesn't have a terrible case of it, but she's not normal, you might say, like other kids are, can't do everything other kids do maybe. Now, the only thing that I could do for someone like that is if they're having pain because of it, or their joints are being irritable, or their tendons or ligaments, then I can help them with that. But I don't do anything involving the neurosystem, okay? And if she had a problem with it when she was born, they may have operated on it to try to reduce it. I don't know the story, but there's probably not a lot that can be done with the neurology of it, the way the nerves are being impacted into the legs.
Well, if it's a single parent, she's not. She's the children bilingual, but she's not. She just speaks Hispanic, Spanish.
Okay.
And so there's a phone number they can call.
But there's not really much I can do for that unless the poor kid is having pain. Yeah.
I wanted to see if I could describe those symptoms. I could get someone to describe those symptoms if they have them, because they have to be done in Spanish.
Well, yeah, she can always. Yeah, we have Spanish people. We have Spanish-speaking people at the office, and they can call. The number to the office is 800-300-9300. But like I said, unless the girl is having pain or joint discomfort or something like that, then there's not much I can do. And now a lot of these kids do end up having issues like that I can help them with, okay?
All right,
so that number to the office is 800-300-9300. And thank you so much for calling, OC. God bless you.
And our number, our number is 866-870-5752. Right here in the studio, give us a call and get your free book right here, right now. Time's are flying by, and let's go to Mike in Burbank.
Uh-oh, Mike from Burbank. It says you were in the office yesterday. That could be good news or bad news.
Mike, are you there?
Yes, I am.
How are you?
I'm here.
Good,
Very
good.
good. Thanks to you.
Oh, that's enough.
Alleviated 12 years of pain.
Oh, my God.
Wow. Wow.
I lucked out, Nita.
What happened? Can you tell your story a little?
Well, over the years, I've had a lot of injuries to my knees. I was in the military, and I jumped out of helicopters a lot, and then I was pretty active till about 12 years ago, hiked a lot and things, and one day I kind of messed up my knee and hiking, and I was told by that doctor that I need a knee replacement in 10 years and just to deal with it. And I luckily heard Dr. Darrow's show a few weeks ago, and I came in at the 1st of January, and he was able to help me. So,
Well, you've made my day. Let me tell you.
yeah, you saw me in the office. I was twirling my knee around. There was no pain.
Oh, yeah. I remember that. I remember you now. Yeah. Yeah, you were laughing and flinging your knee all over the place. Your wife was sitting there, right?
Better than I have in 12 years.
Oh, my
I've
God,
always
that's
had
so
night
crazy.
pain from it. Never able to get comfortable. Wake me up 3 or 4 times a night, and
Yeah.
I've slept through the night
How long
almost
ago?
every night since you did the treatment.
When was it? A couple of weeks ago or so?
Yeah, you did it on January 3rd,
Okay.
and I did exactly what you told me to. I stayed off of it, and I didn't take any kind of pain medication, and
Mm-hmm.
it just over the period of the last 3 weeks, it's just gotten better and better every day. There's nothing there now. I mean, it feels like it did before I injured it, so it's great.
Well, now you can go back in the military and start jumping out of helicopters again.
Nah.
Been there, done that, huh?
No, I'm going to come back and see you and let you work on my left knee. My left one got a little tiny wince in it every once in a while. I'm going to let you do that for my birthday. So.
Oh, that's so sweet. I'll tell you what, if it's your birthday, I'll give you a present.
All right. Make me pain-free, and that's going to be the best present.
Well, that's a present, too, let me tell you. And I know that feeling because I had years of injuries that I healed myself, injecting myself with regenerative medicine, platelets, and stem cells. And I remember the first time it happened, it was like I couldn't believe it was real. And my first healing was my wrist. And the next day after I was actually someone else injected me the first time to turn me on to this type of medicine. And they told me it was going to be stiff for about 24 hours and then would feel better. Did you have that kind of experience where it's stiff for about 24
Yes, sir. Yeah, the very next day, I told my wife, I was like, it's really weird. I don't feel like I had much pain overnight because I don't remember waking up. And she goes, I didn't hear you moaning in your sleep. And she always
That's
heard me. I would almost cry out at night sometimes because when I would turn my leg the wrong way, it would wince, in pain.
Yeah.
And then the next day, I stayed off of it, but it just didn't have that impactful pain that it had over the years, and it was sharp and definite, and it just kind of faded away. It was over the week; it just was gone.
Well, Mike, God
really
bless you, man.
I was able to walk on it throughout the week, and then it was just gone. It evaporated.
Sure.
It was like it evaporated almost.
Yeah, it's amazing. I mean, I've done so many parts of my own body, and to wake up feeling good after being miserable for years.
Really, it was like waking up feeling good. That's a great way to describe it.
It's really one of the greatest blessings that's ever.
Out into the world.
One of the greatest blessings is to have health and after you've been miserable to feel good again. So I'm very grateful for the work I do, not only for helping other people, because that's a fun way to live. It's been a great life for me, but my own healings. I mean, it's just amazing whenever I get injured. And be honest, I do sports pretty hard and I get injured. And when I do it, I'm like, I don't have to worry about it. I know I'm going to be okay because I'll just inject myself.
Yeah.
And anyway, God bless you, Mike.
Grateful.
Yeah, thank you so much for calling in. Give my love to your wife also.
Thank you, Mike. Appreciate your call. Our number is 866-870-5752 right here in the studio, 866-870-5752. Get your free book right now when you phone. It's called Stem Cell and Platelet Therapy, Dr. Darrow's latest book, and the subtitle is Regenerate, Don't Operate. Don't you want to find out what that means with 264 scientific studies?
Plus, if you call, you save Nita from having to answer
another joke.
Very, very difficult jokes. So call me now. The number is 866-870-5752. I would love to talk to you and hear what your issue is, what your family's issues are, what your neighbor's issues are, all of that stuff. You can use a fake name. No one will know it's you. Pretty simple.
Absolutely.
All right, let's get to another question. Actually, I didn't finish up that last one about the pain down the leg.
Okay.
If you're ever going to get a surgery for pain in one of your limbs that your doctor says is coming from your neck or your back, be sure, write this down because it's so important. Get the MRI is important, but it doesn't tell the truth. Get a EMG. EMG stands for electromyogram, and an NCV, that's a nerve conduction study. Okay? Get both of those, and they can tell you where the impaction in the nerve is, if it's a nerve. They can tell you if it's in the back, if it's somewhere down the leg, in the arms. They can tell you if it's at the elbow or the wrist. And if you have that, and it's not coming from your neck, if you don't really have a radiculopathy, that surgery is not going to do you a darn bit of good. Then you've had a surgery you did for nothing. And I'm going to tell you, I get patients in all the time who have surgeries that failed, not because the doctor screwed up, it's just the surgeries don't work. The doctors do great jobs. I love surgeons. It's just that sometimes they're not getting to the pain generator. And these studies of the EMG and nerve conduction study can give you more information to see if you really do need a surgery or if you don't. So,
okay.
I got another question here.
Okay. You want to give the phone number first?
I do. Give me a buzz right now. Talk to me. Let me help you out. Free, what they call it, a curb consult. Give me a call at the studio, 866-870-5752. Okay, let's see. Knee osteoarthritis. Let's see what this person has to say. They say synovial fluid shots, stem cell therapy. Okay, person says, I have arthritis in my knee, no cartilage behind the kneecap, bone spurs, lateral and medial sides. That's per the MRI and X-ray report and the surgeon. Surgeon recommends synovial fluid shots. Do you think stem cell is an option for me? Well, the answer is if you're moving it, yeah. If you can move it, I think that using regenerative medicine can help regrow some cartilage so you can get rid of the pain and make it move even better. Synovial fluid shots, I'm not a proponent of that. There's a million of them out there. Synvisc, others by that name. They are taken from from roosters, from, what is that thing called, that the thing on the top of the head? I forget, I'm blocking. And
their hat?
Yeah, their hat. They wear hats. Maybe it's under their chin. I don't remember. But they take those and they get the synovial fluid from there. They inject it into joints to lubricate them. But they're already lubricated, and people that have arthritis typically have excess synovial fluid there anyway. So I started when I got out of UCLA doing those injections. I didn't find they worked very well. And then now we find out, studies show that when you inject platelets or stem cells, they automatically stimulate the joint to produce synovial fluid, but not a ton of it that gets in the way like my knee had. You know, I had 45 cc's. That's a lot of fluid. But just a drop of it to lubricate. So the other thing, when you inject it, if you're not using an ultrasound to guide the needle and you put that synovial fluid into the soft tissue, that knee or shoulder or hip, wherever they put it, can blow up and you may have to get a incision and drainage, a surgery to clean it out. It looks like an infection. It gets very, very scary. So we have someone hanging here from Laguna Hills. So
It's
Jeff, Dr.
Yeah.
Marc Darrow, thanks for calling. I appreciate that. So you have,
Good morning.
you have what?
I have.
What's your,
I'm 67,
yeah.
and was a former athlete, and had to give up basketball about when I was 60.
Okay.
And my right leg, it seems like affected by perhaps sciatica or some nerve damage, and now I have some. I think it's neuropathy in my right foot, and my right arm's starting to tingle.
Okay.
And I have had some steroid shots in my lower back, and that didn't do anything. And I've done acupuncture and pressure, and I can't walk solid for more than 100 yards before I start tensing up and kind of hurting.
All right. So first of all, the best news I've heard so far that you said is that the steroid shots didn't help you, and that's an indication that it's probably not coming from the nerves in the back, because if it were and a nerve was impinged, that steroid shot would shrink down the tissue there and give you some relief. All right. So that's good news in a way. It's bad news you're still having problems, but it's good news to me because that means what I do can probably help you get better. I'd have to examine you, and I tell people all the time, I say it on the radio every week, if you come in and I examine you, it takes me literally 1 second to know if you have a radiculopathy or if it's just local tissue issues, like sprains. And then a lot of times people...
Do you accept Medicare?
That's something to call the office about. That's 800-300-9300. I'll repeat it for everybody. The office number is 800-300-9300. I don't deal with insurance issues on the radio. It gets really confusing. And although I've been doing this work for a long time, I still don't understand insurance. Everybody's got a different kind of policy, and it's something that's very confusing. So what I'm going to tell you is this, Jeff, there's a chance I can help you, but I won't know unless you want to come into the office and let me examine you.
Okay.
I don't diagnose based on MRIs or X-rays. It just, they fail. They don't show you what's causing the problem. They can, but I'd say more than half the time they don't. So I look at them and I like people to get them. I found a couple cancers by getting an MRI. So I'm glad I got those because we were able to, cut out the cancers. Because you can have a cancer in your back or neck that is impinging a nerve or in the shoulder or something like that. So I like to get MRIs, but they don't usually tell you what the problem is.
Gotcha. Okay, well, I will give the office a call then.
All right, man. I appreciate your calling in. That's good questions, good information, and I think it helps all of us learn a little bit.
Thank you, Doctor. Have a great day and good weekend.
God bless you, man. I appreciate it, Jeff. Annette, Dr. Marc Darrow, you're next in line. How are you today?
Hello?
Hey.
Yeah, hello? Yes, hi. My name is Annette, and I'm 80 years old, and I have several problems that I've been having for many years. One of them is, two of them. I have stenosis in my lower back, in the lumbar side, and also in my neck area.
Okay.
And I also have a bone on my left knee, which I have been avoiding for a long time. I've tried, I put steroids. Steroids help to a certain extent, and then I try not to get many shots anyway.
Okay.
Because I know it's not good for you. And
Okay.
I have a chiropractor who really, he's the only one that really can help me, and it's not permanent, but he's the best chiropractor I've known, And,
Wonderful.
And I was thinking that maybe you can help me, but I also have oh God, I broke my leg. I fell and broke my leg a year and a half ago, and it hasn't really healed too well. I mean, I am healing, but it's because of my back and because of my knee, everything, you know, it's just not producing, especially my age, healing fast enough. Okay. My leg came out of my socket, and so they had to do surgery.
Sure.
And which I avoid surgery like the plague because I know I can't do it. And I had my hip, had to have a partial hip surgery because of it, because it came right out of the socket. Sure. That's kind of stiff. I don't know if you can help me with that, but anyway, that's part of my. Hello.
I'm with you. I'm with you.
Okay.
I'm listening, and now I'd like to respond if you don't mind.
Yeah, sure.
Okay, you got a lot of issues. You didn't mention that you have pain down your arms or legs, correct?
I have. I don't have pain. Yeah, sometimes the chiropractor does help me. You know.
Okay.
Yes, you're right.
Let me respond to that. So I don't think the stenosis is the problem for your neck and your back pain. If it's stenosis, which means a squeezing of the nerves, then you would have pain down your arms and legs, which you don't have. You have neck pain and back pain, which in most cases is from the ligaments being sprained. And the way I talk about it makes people laugh. I say you've got a sprained ankle in your neck or your back. And they go, what are you talking about? I go, it's no different. It doesn't matter where you sprain the ligaments, they hurt. But that doesn't mean because you get a sprained ankle that you get a surgery. People that get sprained ankles, let them heal up. The problem in the neck and back is there's not a good blood supply like there is in the ankle. Because of gravity, a lot of blood pools in the ankles, and blood carries oxygen, which is really the healing agent. So your neck and back, most likely, we can heal up using regenerative medicine, platelets or stem cells, or both. The knee with bone on bone, getting steroid shots in there is suicide. It's killing the cartilage and giving you more arthritis. The hip, which has been partial replacement, we can probably help you with that. And I'm glad you're using a chiropractor to help palliate, lessen the pain you have. I love chiropractors. They do great things. They're natural doctors. And it's very funny because my mentor, when I was his lawyer, told me, next you're going to be a doctor. And I said, great, I'll be a chiropractor. He said, yes, you will, with an MD license. And I laughed. I wanted the way out that didn't take me 10 years. The chiropractic was 3 years, and I thought I would kind of skirt by. And anyway, so I finished medical school, and I got my MD degree. And I went back to him, and I said, great, I'm done. He goes, nope, now it's time for internship. That was another year. Finished that, and I go, okay, I'm done. He goes, nope, now you've got a residency. That was another 3 years. So it was a total of about 10 years getting through that process. And I'm glad I did it. I also did a fellowship after that in regenerative medicine, natural medicine. So I've been pretty well schooled. I had 22 years of college all in all, and I love learning. Anyway, Annette, I think I can help you. The number to the office is 800-300-9300. I'll repeat it for you, 800-300-9300. And Mike has called about his knee. Mike, why don't you email me through the website at www.lastemcells.com and call the office 800-300-9300. God bless you, Nita Valens and Suzette, Alex, and everyone on the staff. And thank you all for calling in and listening to the show. We love you.
Thank you, Dr. Darrow. I'm your host, Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.